One of the things that happened when I got into dentistry is you begin to see that the mouth is the portal to the body. There are a lot of connections to the general health that people don't know. For instance, most people don't even know that the first signs of HIV can be seen in the mouth. When you have diabetes, it shows in your mouth. So the mouth is like the tell sign of everything that is in the body. And data has shown that when we ignore the mouth, we're technically ignoring our body. And that is why we're advocating for the mouth not to be silenced anymore. I grew up in a slum called Agege, Lagos, and the community was full of a lot of inequities. There was lack of access to dental health. Even as a kid, I lacked so much awareness about it. And I remember, I think I was about 8 years old or something when I first discovered I had something on my teeth. And if you looked at me as a child, I wasn't really a smiling child. I couldn't smile in pictures. I couldn't smile anywhere because I was always trying to cover my mouth and cover the shame. And I didn't even know that there was something even called a dentist. My first experience with a dentist was 16 years later, which was when I was in dental school. That experience changed my life because I remember when I walked out of the dentist that day and I looked at myself, I was like, for the first time in my life, I was not ashamed of myself. I was not ashamed of my smile. I was not ashamed of my teeth. And it felt like so much relief. And I think that was one of the reasons why I knew that what I wanted to do was for kids that grew up like me. I wanted to see them look into the mirror and not feel ashamed to be somebody and not feel ashamed to smile at themselves back. How are you doing today? Sit down comfortably. Have you been to the dentist before? So this is your first time? Yes. Okay, so I'm just going to ask you a few questions. There's, I think, 200 million people in Nigeria right now, if data is correct, and we have about 5,000 dentists. And in this community that I am right now, we have over 100,000 people, and there are just about 15 dentists. Yes, ma. The good thing about working in a community that I grew up with is, having a lived experience and being able to relate with the people, being able to relate with the needs of the people in the community. When I go and work with the children, I can be touched by the feelings of their infirmities. I can know what they are relating with. We've seen kids drop out of school because of pain, because dental pain is so severe that the child can't even afford to go to school. Then the mother has to, go away from their workplace just to care for the child. I think this broke my heart every day because every single child that came in, I saw myself in them, and I knew that, okay, I really wanted to start something that would allow free access to oral health education, but also access to services for children.
When we go out to see these children in underserved communities, being impactful means having a long-term effect of this procedure done on them, and which, of course, we promote their self-esteem.
It's more than a passion, it's a calling. And that is why we are here today, so that we can teach you how to take care of your mouth. So you want to show us how to brush? In my organization, most of the work we do is that we go to schools, we go to rural communities, we give the children oral health education, we teach them how to brush their teeth. And understanding from the work that we've done before that children like fun, children like songs, children like animation, we decided to put some creativity into it and say, okay, why not write a book for children? The story from the book just stemmed from my childhood, and I feel like there's a little bit of myself in Anita, and I feel like there's a little bit of every child in Anita because every child loves to eat candies. It's hard to get us to eat like fruits and vegetables sometimes, and we must all admit as children that brushing wasn't fun. So I see Anita as every child out there. So when the book came out and as we began to share the books to schools and to children, Anita has become an household name. Children are bringing out toothbrush. Parents are calling us, what did you do? Like, my child is bringing out their toothbrush every time, wanting to brush like 8 or 9 times a day.
It has improved my children, even myself. It was amazing and we are even enjoying it.
Like, she emphasizes that I brush my teeth daily I should visit the dentist at least twice in a year. She teaches me that.
We've seen the ripple effect of that when we teach children how to brush, it kind of affects the family, it affects their siblings. Understanding that Nigeria is also a country with several ethnicities, why can't we also translate this book into other languages so that children in the deepest rural communities who don't even understand English can still relate with this book and relate with a kid that looks like them? The book was translated to French, Yoruba, Hausa, Igbo, and there's an Ijabi version, for children in the northern part of the community, where Anita now wears an hijab and looks exactly like them. So we were like, okay, we want to make this more visual. We want children to be able to relate with this more. So that was why we developed the animation. I remember just staying in my room one day and the song just popped up and I was like, this is a fun song.
I love to brush every morning. I love to brush my teeth.
And we took it to other children, and before we know it, we incorporated it into the animation.
Go! I love to brush every morning. Good.
I love to brush my teeth.
Yeah.
Every single time we went out there in the communities, the song did it better than telling a dentist standing in front of a kid to say that brush your teeth, brush your teeth, brush your teeth.
Brush, brush, brush. Brushing every day. Brush my tongue. My mouth is fresh and clean.
In terms of the journey into virtual reality, I was like, what if children could feel like they were with Anita? What if children could feel like they are Anita? What if they could go on the journey with her, not just read about it, but experience it firsthand? I think the biggest or proudest moment for me was when one of the kids that read the book wore the VR set and said, this is Anita, I can see her, I can touch her. It felt like this is real. And that was why we knew that the virtual reality was also a game changer to rural communities.
So describe what you're seeing.
Educating kids on dental health is very important because, first of all, kids are champions of any messages. And when it has to do with dental health and oral health diseases, most oral health diseases are preventable. If I had access to oral health education, I wouldn't have to live with a shame for 16 years of my life. So it's very important to tell children, it's important to brush, it's important to see your dentist, it's important to have healthy habits because that could change the course of your life, that could change the course of your destiny. And I think that's the amazing part about the work we do.